All right, Dr. Brentloff, Phoenix Chiropractic Center. We're talking back pain today, and we've got lovely Joe on the table. We're going to tell you what happens, what we're going to do to evaluate back pain and then hopefully fix it, get it better for you. So the first thing we're going to do is we're going to find out the alignment issues with somebody. Somebody has back pain with radiating pain down the leg. We know that there's a nerve that's involved, and we want to find out what nerve that is. So when we take a patient history, we want to find out exactly where that pain is down the leg. If it goes down the back of the leg, then we're suspicious of L5, the lowest vertebrae, being out of place. If it goes down the side of the leg, then we think it's probably going to be L4. And if that pain is referred to the front of the thigh, then we're pretty certain it's going to be L3 that's out of position. Before we do that, we're going to find out if the pelvis and hips are right. And so what we do is we do what's called a leg check. We're doing a comparison of the legs. We're going to stress the body very gently. And the way I move bones, I don't use my hands here. We use an instrument to move the bone. Whether you use hands or an instrument, the bones will move close to 1/2 inch. Okay, so there's no difference in the bone movement depending on which method of adjusting that I'll do. So we're going to check out the leg lengths. We bring the legs up. They look pretty level. Joe's been adjusted recently, so there's not going to be a huge amount of difference like there would be on a new client. We checked her pelvises. They look okay. Her right hip is a bit forward. That shortened the leg when I did the hip test. So we're going to take my activator instrument and adjust the hip towards the ceiling. No muss, no fuss, it didn't hurt. Checking the sacrum, that looks good. Okay, put your right hand on the back, Joe. L5 test is good, arm down, and now the left hand on the back. And L4 is out of position, arm back down. So that's rotated to the right. If that were severe enough, like I said, that could cause pain in the back, but also down the side of the leg, either leg. Okay, now lift the right hip off the bed and back down. All right, so the L3 test, the legs stay the same length, that tells me things are fine. If one leg gets crooked, gets shorter than the other, that tells me that vertebrae that I tested is not right. And when we do these adjustments, then the soft tissue have to hold the bone in the proper place. No different than an orthodontist straightening teeth with braces. There's a time frame involved for those muscles or gums, whatever the issue may be, the mouth or the back. Soft tissue have to come to the party, hold the bony structure in its proper spot. How long that takes is up to the client, the severity of the issue, how long they've had it, what kind of lifestyle they're having and doing, if they're sleeping and eating correctly. All those things play a part. This is Dr. Marcus, Phoenix Chiropractic Center. We'll see you next time.